Hello, and how are you? Welcome to another session of our series, the Nursing Case Study. And in the Nursing Care Case Study, we had introduced the first bit, that is the introduction. We did the aims and objectives, and then we provided the different components that a nursing care case study provides. And in the different components, we initiated now the writing of the nursing care study. And we said the first part is about the history taking. And we provided data on the history taking, which parts to ask from the biodata, all the way to the last bit of other histories like gynecological history and obstetric histories. So if you've not watched these videos of our series on nursing care case study, kindly go to our playlist on nursing care case study and be able to enjoy the different aspects that we've discussed. So in this second part of our component, we're going to explore physical examination. How do we write this in the best way possible, or how rather do we perform this part in the best way possible? So if you're new members, my name is Winnie Barawa, and this channel focuses on lectures, lessons, and interviews pertaining to healthcare. Don't forget to leave a comment, to like our videos, and also share it in your different platforms so that we can grow our community. Join also this community so you can be a member and we grow together. So let's see which components are part and parcel of the physical examination components while we are writing our nursing care case studies. So the physical examination bit encompasses several components or parts, and in here we can have the review of systems, physical exam. In physical exam, we can do it in different segments depending on the one that one prefers, either as a general description of the patient, that is like generally surveying your patient and giving a short description of how the patient looks like. And then we have the head to toe, where you can use a simplified assessment using head to toe model, or you can do systemic assessment, where you describe the physical examination based on the systems. Then we need to do vitals, bring out the investigations and lab studies, looking at both routine and specific. Then you can make a diagnosis. So diagnosis can be either medical or surgical diagnosis based on the history you've taken. If the client is a medical case, or if the client is a surgical case. The first part of physical exam is the reviews of system. So when one decides to do physical examination and incorporate the part of review of system, here we are advised that we describe all the systems, but as you're describing these systems, you're told, can we focus on the systems that have been affected? So like you find that if maybe there's the skin, the ear, nose, and throat, cardiovascular, respiratory, we know those are the major systems. But also, it's advised you don't forget psychiatric assessment, kind of a way. It's a bit also important. However, depending on the case, you can put it in or eliminate it. So in these systems, you are supposed to have like 3 questions that you ask about yourself or about the patient so that you're able to establish key areas that you want to focus on. So in the discussion of the systems, you're told thorough evaluation of several systems pertinent to the history of present illness should be included in the HPI. What does that mean? When you're doing review of system, you don't write all the systems. We're going to write the systems that seem to have been affected in the history that you took. So if you're doing the history of presenting illness and you've established the chief complaints, you can tell from the chief complaint and the history of present illness the systems that have been affected in this illness. So if you are discussing the system that have been affected, that's how you review those systems and you provide key areas of focus or key areas that have been affected and you describe them. So that's how review of system is done. It's not like the main part of the physical exam, but it's an important area that you highlight what system has been affected by this illness that you've described in the history of presenting illness, and then you can state which parts are coming out that seems to be going wrong in that particular patient. And then the next bit now is the main part of the physical exam. And here it's always advised you start with the general description first. So this is like a general survey of your client. It's just like when you look at your client, what do you see? So you can describe it in aspects of comfort. You can look at components of distress of patient, if the patient appearance is the client need, the client hygienic, or are there appearances that you feel make the patient look unkept or confused. So you will look at specific features and describe. You can also look at the hygiene status of the patient. You can generally describe the nutrition status by check, and then you can look at orientation. So in orientation, that is more of trying to establish psychiatric status if the client is oriented to place, person, and time. So that's mostly caters for the general description. It's not normally detailed. It's a brief explanation pertaining to the general survey that you've made on the client. Then when it comes to head and neck, here the target is to start assessing our client from the topmost part to the lowest level, that is the lower limb. So we start from the head all the way downwards until we reach the lower limbs or in the legs. So I saw this way easier where you start with the first segment, which is head and neck. So as you state head and neck, you need to highlight the small subheadings where you talk about the hair, you talk about the scalp, describe the skull, the face, the eyes, the nose, the ears, mouth, and then the neck, so that you come downwards in an organized way. So even if they say talk about head and neck, it's not just a haphazard description. It has a systematic organization that you need to use. So bring out the hair, discuss the scalp, go into the skull, the face, the eyes, the nose, the ears, the mouth, and the neck. So in that order. When you finish with the neck, the second follow-up place is the upper limbs. So in the upper limbs, you discuss more about them, like are they symmetrical, the length, describe about such. And then from the upper limb, now you flow down to the chest. So in the chest, there's a technique we need to use, and this technique is organized in the aspect of inspection, palpation, percussion, and auscultation. So that's how we flow with this order. And if also you want to understand how chest examinations are done, I've provided also another video on this where it comes to the respiratory diseases. There's a whole two or three videos there that talk about the inspection of the chest, describe how to do the inspection, palpation, percussion, and auscultation. So when you're looking at the chest, when you do auscultation, we are also supposed to include the heart and the respiratory organs because they are located in the chest together. And then we got the abdomen. So in the abdomen, the assessment model or the assessment techniques are a bit different from the chest. So in here, we are going to use the aspect of inspection, auscultation, percussion, palpation, then percussion. So it does not follow the same order the chest is using. So in here, we start with inspection, auscultation, palpation, and then we finish with percussion. And in this, we are going to follow the 4 abdominal quadrants to help us enable to know the organs that you're palpating on or the organs that you are investigating on, so that you can have a flow also. So from the abdomen, flow to the pelvis or the genitalia areas. And here we need to be specific about either being male genitalia or female genitalia. So in here, you want to check on inspecting and palpating. There is no much of percussions or auscultation here. The main techniques we're using is inspection and palpations. And in the lower limbs, again, we establish more of inspection and checking the limbs, whether they are symmetrical, their length, their alignment, so on and so forth. So that's how the head and neck criteria flows. You have your segment from the head and neck, upper limbs, chest, abdomen, we flow to the genitalia, and then we go to the lower limbs. So that's how we flow with these different aspects. But if we decide to do the systemic assessment is organized in such a way that we have to describe each and every part of a system in the body. So the systems in our body, they're almost like 11 systems, depending on how we subdivide them. But also we flow with the first general exam, just like in the head to toe. So in the general survey, there's specific ways of how we describe this under the systemic assessment, and we can use the acronym PICOL. So in PICOL, we are looking at P, which describes pallor. So you need to bring out component. If there's pallor, you indicate there if it's positive. And then there's jaundice, which is also for eye, that is icterus. So jaundice is yellowness of the eyes, the skin, or the palms, and you want to check if that is also there. Then the other general assessment we're doing for the client is cyanosis, that is the bluishness either in the mucosal areas, in the membranes. You want to say that to check for signs of severe lack of oxygen, but there's also clubbing, like you can assess finger clubbing or generally clubbing in the extremities so that you can see if our client could be having any signs of poor circulation. And then we got coelonachia. This is spooning of nails, which is said to be very common for clients who have anemia. Then in the other bit is exploring the lymphatic organs by checking any signs of lymphadenopathy and aspects of edema. So lymphadenopathy and edema, they help us in understanding the aspect of circulation in our blood vessels and the flow of fluids in our body. And then from the general survey, we now flow to each system in detail. So with each system, we describe each system and provide detailed information from each aspect. However, we are told you can focus on systems that have presented in the chief complaint or have presented in the history of presenting illness. So just to remind us on the systems, so we have one of the systems that is the immune system. We have the digestive system, we have cardiovascular systems, integumentary system, respiratory system, the endocrine systems, reproductive systems, excretory system, musculoskeletal system, the nervous system. These are key systems of our body that should be described in our physical exam when we decide to do the systemic assessment. So in here, we will not flow like the head and neck, but yes, sometimes you can use the idea of head and neck to guide you on how to pick the systems as you flow downwards. For example, in the head and neck, there is systems like the nervous system. So you can start with that and describe it. In the head and neck, we have sensory systems there, or special senses. So you can talk about the nose, the mouth, the tongue. Those are sensory systems that you can pick them on and describe them. But then as we keep flowing, you meet the respiratory system on the chest, we meet the cardiovascular systems. Then you have the musculoskeletal system through the shoulders and the upper limbs. So you can flow downwards using that. It really helps one to establish these systems easily as opposed to trying to just haphazardly put in the systems and describe them. So in the physical exam, when you're doing systemic assessment, you have to pick each system and assess it correctly. Now, in assessment of each system, there are different techniques one has to follow. So it's not just generally the way we did it in the head and neck. So on that, we might want to read further and understand how every system is assessed. So for example, there's a specific assessment for integumentary system, that is the skin. There's a specific way you need to do the cardiovascular system assessment. So all these systems have different models or different approaches to it. But the main aspect is you need to give detailed information, and then you need to try and be relating or relate to the chief complaints and the history of presenting illness that you have established. Then the following part after we have done exhaustive physical exam is the vital signs. So in the vital signs, you're told do thorough vital signs check, and this could include not just the normal TPRs where we are talking about temperature, the pulse and the blood pressure, or the respiratory rate. Here you want to be as in-depth as possible. So include other aspects of vital signs that are important for you to include in your client. So temperature is key. Of course, this is to establish any signs of fever, change of temperature in the form of either hyperthermia or hypothermia. Then there's pulse rate, that is doing pulse checkup to tell if the patient has increased heart rate or low heart rate, that is in form of tachycardia or bradycardia. Then there's blood pressure to establish hypotension or hypertension status. Then there's respiratory rate, that is either you want to tell aspect of tachypnea and or aspect of apneas. And then you got oxygen levels. This is through oximetry checks, or you can do arterial blood gas checks to tell if the client could be having hypoxia or the patient has proper ventilation. Then we have height and weight, which is very key to establish status of malnutrition or nutritional status, which will enable you to tell the body mass index, that is BMI, and to understand any nutritional related changes that our patient could have. And then we got orthostatic blood pressure and heart rate, which depending on the need, that is when appropriate, you can do that to establish the different changes of the circulation of our client. But don't forget level of consciousness. That is, you want to check level of orientation to time, to space and person, that you can see that the client mentally is established or mentally is well oriented. And then we got time or pain, sorry. So in establishing pain as a vital sign, this depends also on the presenting illness. If the client has chief complaints of pain, it's good that you do the pain rate so that you can tell if the pain is 10 over 10 or the pain is at what different categories. You can establish if your client has mild pain, moderate pain, or severe level of pain, and you can that can help in establishing the management, the next step of action. But then this brings us now to the following aspect, that is now on investigations. So when we are doing investigation, there are two categories of investigations here. We have the routine test. This shows key tests that can be done for majorly like all possibly presenting illnesses that you can have. They're the baseline test that they can establish us, or they can give us the beginning point of our management. And the common tests are blood works, where you can tell either you want to do complete blood counts, or you want to establish hemoglobin levels, or you want to do routine investigations of infections, that is blood levels. So when you do routine checks, the main agenda is to have a foundational basics where you can tell the origin of the illness, whether it's an infection or you find if it's an injury, you want to do like basic imaging checks. If it's a signs of infection, you want to do basic culture sensitivities to just establish these routine checks. But when it comes to specific investigations, these normally relate to the diagnosis that the client has been given, whether it's a medical diagnosis or if it's a surgical diagnosis. And as a person who is writing a nursing care plan, this is the level where you are supposed to attach the findings and the results. So if you're putting together these documents, you need, if you're not supposed to go with an original, of course, you will need to do photocopies and attach them at these particular levels. And then document all the tests ordered at or just prior to the admission. So you need to bring out each and every test that were done, and then you pull them together and provide them on those on your write-up. Then you need to group the test also logically so that it does not look confused. So for example, for clients who've been admitted with chest complaints or chest pains, in this client, mostly their proposal of tests like electrocardiographs or chest x-rays. So in this case, you may list these specific checks as the first one. So, or you can group them together. If it's imaging test or imaging investigation, you can put all the imaging investigations together. If it was blood test, you can put all the blood tests together. So you're told group the test logically, it will make our work easy. It will make your document look organized. It will make your document look neat. And then normally abnormal results of your test are also compared to prior tests if they are available. So if your client describes that they were admitted maybe some time back and they're coming in for a readmission procedure or a readmission process, you may want to compare prior or previous checks that were done on them with the current checks. If there's a severity detected, you can see how to handle it. If it's just the same, then you can want to compare and check on which steps to take forward. But on the investigation bit, you provide all the investigations that were done and provide the findings or attach the findings and the results. And then the last bit after the investigation is providing synthesis, summary, or diagnosis. So in this, you want to give a final diagnosis based on the aspects we've done. Remember, we started from history taking. And again, if you've not watched on the history taking video, you can go there and watch it so that you understand how the history is done. Now, after that history, we've come to the physical exam and we are exploring the different components. You're saying we can have the review of systems, you can have head to toe if you wish to take that route, or you can do systemic examination if you wish to do the systemic way. But after that, we do the vital signs, we do the investigations. Now, this is a lot of information that we are now supposed to integrate it together and provide 2 or 3 line description with the key information that we obtained from the history that we took, the examination that we've done, and the studies that is going to give us a leading diagnosis. So we're told if possible, that is, if you can find the final or the leading diagnosis, is possible. But sometimes you can have a diagnostic imperative. That is something that you may change later on. However, we should be committed as students to have the leading diagnosis or the confirmatory diagnosis in this case, so that you come with the final one that you know you're going to manage throughout this case. Because it will be so unfortunate if you provide an impression diagnosis and then when now you find the confirmatory, you find that it's totally different from the impressive that you gave or the imperative diagnosis that you gave. So get to have the confirmatory diagnosis or the leading diagnosis so that when you start the management, it will have a flow all the way to the end. So what are we supposed to do on the synthesis or the summary or the diagnosis side? You give a 2 or 3 line description that summarizes the information that is very key that you got from the history, the physical examination, and the different studies that you've done on this patient. And then that leads us into making the diagnosis. So this is the diagnosis that is going to guide us in our next step. And in the next step, we're going to discuss about the admission process. So you're going to have clear way of how to do the admission. And then in this admission, which management we're going to give all the way to the discharge level of our clients. So I really, really appreciate you for being with us all the way to the end. Don't forget to like our videos, give it some comments, leave a comment there, share these videos, and also remember to subscribe if you've not done so. Okay, up to this level, I really appreciate your commitment and bye-bye until we meet again in our next lessons. See you.